Hi, my name is Chelsea Deitch, and I'm going to explain to you how I met my 8 clinical objectives for Nursing 335 Leadership in Nursing class. The first objective is to utilize previous knowledge of the sciences, liberal arts, information technologies, and nursing to develop skills as a nurse leader. I met this objective by volunteering at Phoebe Home Nursing and Rehabilitation Center in Allentown. There, I volunteered on the severe dementia and Alzheimer's unit. I helped with activities such as painting nails. Um, I helped with transporting patients, but I also helped doing activities such as like the music classes. They had a pianist come in a lot and play music for the residents, and it was amazing how they could remember how to sing the songs and dance to the music. And I actually learned in my 321 class, Health Promotion 2, that severe dementia and Alzheimer's patients, music evokes emotions that bring back memories. And I also utilized Alzheimer's.net to do a little research on the music and how it affects dementia and Alzheimer patients. And that said that music, amplitude, and appreciation are two of the last remaining abilities in dementia patients. Music can bring emotional and physical closeness, and singing engages the residents, and the music can help shift the mood and minimize the stress and stimulate positive interactions between residents. The second way I met this objective is through my peer leadership observations, which were Nursing 309 and Nursing 320. 309, I helped the patients take vital signs, do head to toe assessments, and I learned all that information in my Nursing 311 class, which was health assessment, where we learned to do the full head to toe assessments and take vital signs efficiently. For Nursing 320, which was my mom baby clinical, I helped those students in distinguishing fetal heart rate monitoring using my previous knowledge from 320 that I learned in lecture. And I also helped assist the professor, assist students in administering vitamin K shots to newborns. And a father of one of the babies actually asked me why the patient was receiving the newborn was receiving the vitamin K shot. And I educated him using my knowledge from Nursing 320 that vitamin K is given to newborns because they do not have the good bacteria in their intestines, which contains the clotting factors to help prevent hemorrhage in newborns. So I thought that was a good education opportunity for me to share. Objective number 2 is to apply basic principles of management to meet the challenge of an ever changing healthcare environment. I met this objective through my nurse supervisor experience. I had my nurse supervisor at Lehigh Valley Muhlenberg, and I actually observed the nurse manager using her management skills, calling people, talking with the nurse managers on the different units, helping to staff every unit appropriately with the correct number of nurses, techs, and one-to-ones to help them have better quality care for their patients. I also met this objective through my advanced practice nursing clinical experience, which was I observed a cardiac and wound manager um, at Moravian Village, and I actually observed the wound manager helping educate and use her management skills for a new nurse on redressing an ileostomy on a patient that would not stay attached. She used her knowledge to help teach that new nurse and her management skills on how to prioritize that. And it was a great learning experience. For Objective 3, it is to demonstrate leadership skills through effective use of communication by representing self, the college, and nursing in a professional manner. I met this objective through the advanced practice nursing experience, where I observed the cardiac/wound nurse manager have to give a presentation in a meeting with all of the other healthcare staff disciplines about a Department of Health um, complaint that was filed by a resident because a resident's family member, because a resident had a deep tissue injury that formed on her heel, and nobody on the unit documented it or brought it to the attention until the family member found it. So they filed a complaint. and the nurse manager had to speak in front of everyone and just basically state how she was going to help prevent this issue from occurring again. So the things that she said were to every shift a nurse needs to do a head-to-toe skin assessment, which they should be doing anyways, but they also now have to write down on a little skin assessment sheet and drop it off in the office for the nurse manager to check. All the skin assessments are being done on every shift. She created a PowerPoint also to share and teach every nurse on the unit about how to properly do the skin assessments and proper way to document. And she also now has to go into everyone's charts and make sure that skin assessments are being documented correctly. I also met this objective through my dietitian experience. I observed the dietitian collaborating with a nurse about a patient's care, and the patient was malnourished and she wasn't getting the correct nutrients. So the nurse and the dietitian were collaborating on ways that the patient could get better nourishment. And the dietitian stated about adding a supplement drink to her diet. But she also educated the nurse and told the nurse to make sure that the patient drinks it at not with lunches, but as like an afternoon snack, because if she drinks it during lunch, she'll be too full and won't be able to consume her meal for the day. And the nurse kind of just collaborated with her and discussed things that she liked, and she really liked chocolate, so they decided to do the chocolate supplement shakes together. Objective 4 was met. The objective 4 is critically evaluate and disseminate current research related to the principles of leadership and the effects on the healthcare system. I met this objective through my continuing education experience. I went to the St. Luke's Trauma Conference at Steel Stacks, and a doctor presented this research on Stop the Bleed, which we also talked about a little bit at our Capitol Hill experience. But he gave an explanation about the Stop the Bleed kit, which is this kit that helps prevent, like, if there's a mass like casualty that occurs and people are having having bleeding. It's the Stop the Bleed kit that has a tourniquet in there, some gauze to pack, and it was just initiation that they wanted to implement it and put it around AEDs, because that's an important thing that needs to be done when any kind of mass casualties or anything like that happens. Applying tourniquets are pretty easy. Almost anyone could do it. And I actually did a little bit more research on this, and they want to start implementing it and try to get it to be trained with CPR. The Stop the Bleed, to train for that, the guy said in the research that it only takes about like 20 minutes to do, and that they already have it implemented on the western side of Pennsylvania. And actually one of my colleagues has started an initiative to get it started on the eastern side of Pennsylvania, which I'll be talking about in a later objective. I also met the 4th objective by this article that I found. It's an ethical article about ethical issues with medical errors shaping a culture of safety in healthcare. It's basically about an article of a nurse who administered a chemo medication, double of the amount that should be administered. And we actually learned in lecture and in our lecture about beneficence and non-maleficence, which is basically to help avoid harm and to do what's best for the patients. And in this situation, the nurse realized what she did. She immediately went to, even though she did cause a little bit of harm to the patient did have some severe side effects, but she immediately went to her nurse supervisor, explained the situation. They helped get this all under control, make sure that she actually did do the error. So she was basically doing what was best for the patient, and she was going and telling her supervisor. And then they went and actually told the patient exactly what happened, and the patient was a little upset but was understanding about that. So in lecture, that's what we learned about. And that's how I applied that to this objective. I also did some research on my leadership paper, which was on the effects of social media usage and nurses. And I did research on that topic and talked about the ethical dilemmas that occur with social media usage and nurses. Objective number 5 is to function as a competent patient advocate, nurse advocate, and change agent. So for this one, I'm using the ANA Code of Ethics. Provision 3, which is the nurse promotes, advocates for, and protects the rights, health, and safety of the patient. So I observed this in my advanced practice nurse, the cardiac and wound manager. She was an advocate for her resident. She was telling the doctor that the patient was really in severe pain, and her pain treatment was not working, and that the resident has expressed this feeling to her many times. So she was being an advocate for her patient and telling the doctor what the patient truly felt. I also met this objective through my nurse supervisor experience at Lehigh Valley Muhlenberg. I witnessed the nurse supervisor using her management skills, being an advocate for her employees, demanding that they need another nurse on the regional heart unit because they would be short-staffed without it, and they wouldn't be able to provide quality care. Objective 6 is formulate plans for continued personal leadership growth and development as an independent practitioner of nursing and contributing member of society. I met this objective through this objective kind of is explaining things that I want to do in my future. I definitely want to join PSNA, which is the Professional Student Nurse Association, just to stay up to date with everything that's going on with nursing and bills that are going to be trying to get passed. I want to stay in touch with the advanced practice nurse that I observed. I got her email and information. She's a cardiac and wound manager, and I am very interested in cardiac. And I'm interested in doing possibly my independent practicum on the regional heart unit. So I thought she was a great person to keep in contact with about any questions that I have or any information, or possibly even shadowing her another time. And then I'd also like to, I met this objective because I volunteered at Meals on Wheels, and I realized that this is a great thing to contribute to society, and I really would like to become a volunteer for Meals on Wheels once I'm finished with nursing school. Objective 7 is to recognize the role of the nurse in policy making related to healthcare services at local, state, national, and global levels. So I met this objective through Capitol Hill experience, where we went to Harrisburg. Learned that it's very important for nurses to be involved politically, and that we do have a voice, and if we express that, things can change. And we also went around with one of my colleagues who created the Stop the Bleed initiation. We went around to different legislators and discussed our feelings about this Stop the Bleed kits and informed them on how these are so important. And I think she's actually doing pretty well with that, my colleague. She's been doing a lot with that around campus and everything too. I also met this number 7 objective through PSNA. We had 2 speakers come to talk about PSNA for us, and they talked about how once you become a nurse that you really need to stay connected and be involved with the current bills that are in the process of being passed, and becoming an advocate for myself as a nurse and other nurses, because that's the only way that change is going to occur. Objective number 8 is predict and describe potential ethical dilemmas within clinical, organizational, and professional nursing practice. I met this objective through my peer leadership Nursing 309 course. I actually observed a nurse administer an enema to a patient while she was standing up. Now, in nursing school, we didn't learn to do it that way. But then she continued to administer this enema after it was dropped on the floor. I kind of tried to tell the nurse, is that okay to still do that? Just to let her know that I was a little worried that she was doing that after this medication did fall on the ground. And she said that it was okay. And then after that experience happened, I went immediately and told my professor about the situation. I also met this objective through my advanced practice nurse. I observed a group of nurses talking inappropriately and unprofessionally about another nurse on the unit on how she takes long to care for her patients and doesn't get all of her work done, and talking about how she requests off and always is taking vacation or sick days. I felt that that was very inappropriate, and that it should have been addressed personally to the nurse manager, and then she could figure out how to deal with this information, with this issue, and talk to the person one-on-one instead of the colleagues talking about the patient. It was very ineffective and almost considered triangling. But that is how I met my clinical objectives for nursing 335. Thank you for listening.